Risk of pediatric celiac disease according to the HLA allotype and country. Definition. In a large international prospective core study, we found that screening the genetically susceptible infant can lead to a diagnosis of celiac disease at very early age. This finding may be useful in considering future recommendations for the initiation of screening in at-risk children. We also found the homozygote for HLA allotype DR3 DQ2 confers the high risk of celiac disease autonomy and celiac disease in all countries that we include the study and was associated with the early signs. Pros. Our findings also confirm the observation that DR3 DQ2 homozygote is associated with an early age at the onset of celiac disease autoimmunity. In our study, 26% of children with higher risk allotype have celiac disease autoimmunity by the age of 5 years. These effects are compounded by a family history and celiac disease, female sex, country of residence. So here we're gonna see a video. What is celiac?
Celiac is a disease that affects the small intestine. It is a genetic disease, so people who have it are born with it. The small intestine is lined with villi, which absorb nutrients. Celiac causes the villi to be damaged, and the villi can't absorb the right nutrients. Some of the symptoms of celiac include abdominal cramps, dehydration, energy loss, fatigue, mouth sores, muscle cramping, dry skin, depression, mood changes, bone disease, iron deficiency anemia, and in children, slow development and weight loss or gain. Some people, however, have hardly any or no symptoms at all.
So continue. Cons. This factor has allowed us to make the observation that even after matching for allotype, Swedish children have a substantially higher risk of both celiac disease autoimmunity and celiac disease than those from the other countries we studied, and that celiac disease autoimmunity developed at the early age. The age at which gluten is introduced of the diet has been reported to affect the risk of celiac disease autoimmunity in genetically predisposed children. So in conclusion, our findings indicate the need for a study of the complex relationship among genetic, environmental, and gestational factors that may play a role in the development of celiac disease in early childhood. So we're gonna see another video.
I am Dr. James Pacino. Celiac disease and gluten sensitivity, symptoms, diagnosis, and gluten-free treatment. Now, celiac disease is an autoimmune inflammatory condition of the small intestine, and it's caused by a reaction to gliadin. Now, gliadin is a polypeptide component of wheat, rye, barley, and also oat flour. And when you ingest it, it sort of triggers this immune response. And the immune cells and the whole inflammatory response that's going on actually damages the cells that line the intestinal tract. And because those cells actually make many of the digestive enzymes that we need, and now you can't make those enzymes because the cells are destroyed, you can't absorb properly carbohydrates, proteins, and fat. So the result is the person starts losing weight, and they have intestinal symptoms, diarrhea, and other complaints. They also get a range of other symptoms that are mild to severe. So the most common symptoms that a person has is abdominal cramping and diarrhea. In a child, you'll see growth failure. They fail to thrive. In an adult, they'll start losing weight. And then because of iron deficiency and protein deficiency, they end up with anemia. And other signs of nutrient deficiencies can occur, and other symptoms as well. Now, to find out if you have celiac disease, right now there's a very simple blood test that you can undergo. So there's no excuse now for not being tested if you think you have some symptoms. And people who come from families where one family member has celiac disease should be tested, because celiac disease can be asymptomatic in a lot of people. So you should really go and be tested. And certain cultures actually, for genetic reasons, are just more susceptible to the development of celiac disease.
Thank you.